Was referred to me for a very routine injection that I normally do in the office. They brought their male relative with them to help them during the injection. As with every procedure and patient, I always discuss the risks, the benefits, the likely outcomes, the duration of the treatment, and the alternatives that if you don't want the injection, these are the things that we can do instead. The patient agreed to the injection and I said, great, let me grab my stuff, my ultrasound, my medical assistant, and let's go. As I'm about to do it with a very large needle in my hand, the male relative abruptly stops me and says, hold on, wait a minute, how many of these have you done, and are you sure you can do this? I was so taken aback because I had a large needle in my hand and I was right about to perform the injection. I very calmly explained that this is a super routine injection. I've done at least 4,000 or 5,000 of them at this point. I reviewed the anatomy around the knee, the muscles, the tendons, the bones, and where exactly that I was going, and I showed them on an anatomic picture what I was looking at. After this, he felt comfortable with me performing the injection. I do think that it's a function of potentially my age and my gender. This happens to me multiple times throughout the day, and so what I've gotten used to doing is I've gotten used to over-explaining myself and also reviewing the anatomy in excruciating detail just so that they know I do know all the bones in the body, I know all the muscles in the body, I know how they work, where they're attached, their blood supply, and their nerve supply. Let me know if you guys have ever experienced something similar, whether it was regarding your age at work or your gender.